Luke from Vital Movements. Real solution for dental professionals, not only treating the symptoms. Right, number 3 in the top 3 exercises for dental professionals is called the table slider. The table slider is an exercise I developed for dental professionals to successfully use their arms in front and hold their arms in this position for long periods of time without causing the problematic pain and inflammation of the neck muscles. Okay, as dental professionals, you're working with your hands in front of you, unsupported, unlike those that work at a desk that have a nice surface to rest and take the weight of the arms. You're there for long periods of time, passing instruments, working with your hands in front. It's imperative to use the right movement pattern of the shoulder to make sure you're not creating pain and inflammation and you're not causing problems in your body. Okay. The shoulder is an amazing joint. It has a huge range of movement, but because of that, it has poor stability and needs a lot of muscles to work at the same time in harmony to successfully move the shoulder with correct movement patterns. All right, the table slider is an easy exercise that only needs a flat surface, such as a desk or a kitchen table, and it is going to teach that shoulder what to do. The shoulder has a backstop to help move and stabilize, which is the shoulder blade, the scapula. Now, the scapula needs to move in a certain way in order for the correct movement pattern of the shoulder, in turn the way you're using when you lift your arms. The scapula, what I see in practice is a lot of people with their hands in front, raising the shoulder as they should with the deltoid. This muscle is not designed to stay in this position for long periods of time. It will tire. Then people generally raise the shoulders bit by bit and contract the upper trapezius, the levator scapula, plus the other neck muscles to maintain this position with your arms in front. All right, this is a very problematic movement pattern that creates inflammation and contraction and lots of pain through the neck, upper neck, shoulder area. What should happen is that as your arms raise, okay, as your arms raise in front of you, that shoulder should stay down. The scapula should slightly depress, upwardly rotate, tilt, as though it's moving under your armpit. Okay. Whilst doing that, you're going to be using a lot of muscles in your back, all right, such as lower trapezius, mid trapezius, serratus anterior, which is a lovely muscle that connects to the inside border of the scapula, wraps around like fingers, holds on to your ribs individually, and this muscle helps or creates that movement of upward rotation. It also stabilizes your scapula snug up against your rib cage as it moves, which it should. So in order for you to be able to maintain these positions without pain and problems, we need to get the scapula moving in the right direction as your arms raise, and we need to activate those muscles in the back to keep this movement pattern or keep this contraction as it should be. So let's get through and look at the exercise and get the shoulders moving the way they should. This is imperative to nail this movement pattern and to strengthen, then take it across and use it in practice. Let's have a look at the exercise. Luke from Vital Movements. Real solution for dental professionals, not only treating the symptoms. We're going over exercise number 3 of the top 3, which is table sliders. Remember, table sliders is designed to teach your body how to move correctly through the shoulder and what's happening inside as you raise your arms in front and maintain them there to work. Table sliders is simple. We don't need any equipment. We just need a flat surface such as a office desk, kitchen table, coffee table, kneeling on the floor. They all work. All right, so the key is we're going to lean forward from that hip joint. All right, remember, from that hip joint, we don't want this roundy back business. From the hip joint, we're slightly leaning forward. Elbows. Right now, my elbows are in line, as you can see, in line with my shoulder. Thumbs are up, externally rotate. Now, the friction is what we're going to use as resistance. Simple. Moving forward and back on a slight outward angle. Maintaining this position. All right, I'm thinking about pushing my elbow forward and back. Now, as I do this movement pattern, the thought is the most important part. I'm thinking of my shoulder staying down. I'm not allowing my shoulder to rise because that is the old pattern we're trying to eliminate. Shoulder staying down, I think of my scapula moving down and under my armpit as my hands come forward. Okay, the entire time thinking about that, because that is what is going to create the movement pattern. Now, you should be feeling, once you get some sort of familiarity with the exercise, you should feel some sort of muscle activation, discomfort, work here in the lower trapezius, underneath the scapula. All right, once you get very good at this, you might also start to feel that serratus anterior coming in. But the key is your shoulders stay down. As your arms come forward, there is no raising of the shoulder. Default, by setting those shoulders down, the movement pattern should happen. And now this movement pattern is imperative to get correct. This is the pattern that you guys use constantly throughout the day, and it needs to be nailed in an exercise setting before it can be taken through and used successfully in practice. You can attempt to use this in practice and it will help. I also suggest you do a few of these, if you can, in between patients to get the right activation whilst you're working. The key is for this to happen whilst you're working when you don't have to think about it. At first you will, but there are other things that you need to be concentrating on whilst you're working. So, 3 sets, 6 to 10. If you're having a lot of trouble, drop down to one side so you can focus on that side one at a time. The more you do this, the easier it will become and the pattern will become more familiar. We have to walk that skinny pathway until we make a road, and eventually it will become a highway. And at that point, you can use this pattern effortlessly whilst working all the time. Give it a try.